things like assault, battery, false imprisonment, negligence. We need to know what these are and keep in mind to avoid them. And of course, remember, everything is about the patient. So always keep the rights of the patient in mind during diagnosis and treatment. So, the first thing we need to talk about is informed consent. You have our little comic here, right? How many medical device professionals are needed to change a light bulb? Answer, well, first you need the light bulb's consent. Okay. So, every human being of adult years and sound mind has a right to determine what shall be done with his or her own body. If you look at this right here, this sounds a lot like something we discussed last chapter. This sounds like autonomy, right? The right to do what you want with, or to decide what happens to your own body. So, informed consent is here to protect autonomy, protect the autonomy of the individual patient. The patient gets the final say on what does or does not happen to their body. It's here to protect the patient's status as a human being, right? No using patients as lab rats. Okay? It's here to avoid fraud and duress. You can't just order procedures and then charge the patient for procedures without their consent. Used to encourage healthcare practitioners to consider their decisions carefully. Foster rational decision-making by the patient. Right? The patient is the one to think through the plan of care and decide what does and does not end up happening. Okay? And then this also helps to involve the public in medicine. Right? There is buy-in from the patient because the patient has control. This is informed consent. Okay? The patient gets to determine what happens to their body.
Mr. Phung?
Yes.
I'm sorry. So how, and if this is like necessarily outside the scope of what we're learning, then I guess we can skip it. But how does this become political?
Political.
Like with regards to what's going on or what has been going on lately with regards to the women's rights and you know, the A word.
I see.
I don't know how people feel about that here.
Ooh, don't get started. No, I'm just kidding.
See, I don't know where that could go. So
we'll hold that until the end of class, and then let me think about whether or not you will discuss that.
So what's
Yes. Autonomy? So informed consent is a way for us to protect autonomy. Right? Sure. So for example, I'm a patient. I go, or let's say that you're a patient, Melody, and you go into the hospital and they say, all right, we need to do a myelogram study on you. All right, so get over here on the table. We're going to do a myelogram. Just put a needle, lay you on your stomach, put a needle, and just shove it in your back, right? Did you know what a myelogram is?
I think we went over it with Mr. Donahue. I think I got that question wrong because I put something about the muscles. But it is the neuro.
Okay, so what is a myelogram? So you think that it might be something with neuro. Yes, it is something with neuro, but exactly what is it about neuro? Right, and a patient would know even less. So, if you just tell a patient that you're going to perform a myelogram on them, and then you just try to do the myelogram without saying anything else, right? The patient really doesn't know what you're about to do to them, right? They are no longer in control of what you're going to do to their body, right? So you need to give informed consent. You need to explain the procedure, right? All right, this is a myelogram. You need to explain the benefits, why we would do the myelogram. you would need to explain the risks. What are the dangers of getting a myelogram? Right? And then you would need the patient, right, to agree to getting the myelogram. Okay? Only then can we say that yes, the patient knows what is going on, and it is their decision. They have chosen what will happen. Right? That is where patient autonomy comes in. The patient chooses what will happen to his or her body, and they need to have all the information necessary to make that informed decision. Okay?
Would that be kind of like when we were doing our AIDIT and you were playing that patient that just walked out? He's like, oh no, I don't want that. Then he just walked out.
Yes, that
That
is
would be
patient
autonomy.
autonomy, yes. They can choose to say, no, I do not want this procedure. And as a healthcare professional,
Against
you
medical
cannot
advice.
force them to get that procedure.
The term like against medical advice is just that, it's advice. You can't
Correct.
really, yeah.
Very good. So when we talked about abbreviations last class, and we had AMA, against medical advice. Patient left the hospital, AMA. They left the hospital against medical advice. We told the patient, it could be dangerous if you leave now. Your blood pressure is really elevated. You could end up having a heart attack 30 minutes down the line. Patient's like, no, I don't care. I'm leaving now. Patient has autonomy. They get to choose what happens to themselves. So there is no choice but to let the patient go after explaining the information to them.
And we can't refuse treatment if and what, like, whatever happens we said was gonna happen happens, and they come back, right?
Correct. So if in 50 minutes they come back in an ambulance because they had a heart attack, we still have to treat the patient. You can't be like, ha ha, I told you, told you so, you deserve it.
That's where the like repeat offenders come in with like people who have that disorder they eat stuff.
Correct.
Okay.
Right? No, you cannot refuse treatment like that. Right, so types of law. Okay. First of all, we have constitutional law, right? Comes from the Constitution of the United States. Right? There's the Constitution and of course the Bill of Rights that goes along with it. Right? And all those amendments. We have laws created by legislative bodies and administrative agencies. We have case-by-case basis for law, called case law. So these are used to kind of iron out or add detail to law. And then we have contract law as well. Now, what we are probably going to be most concerned about here in radiology are torts. Bless you. So torts, first and foremost, are not criminal. Tort law and criminal law are different. Torts are civil. Okay, torts are civil. So a tort is a wrongful act or some infringement of a right leading to civil legal liability. Okay, so infringement of a right other than contracts, because that's contract law. So yes, like a breach, or a like overstepping. So assault is considered to be a tort. Battery is a tort. False imprisonment is a tort. Defamation is a tort. Fraud is a tort. Negligence is a tort. These are civil legal liabilities. So, now once again, remember I am not a lawyer, but the main difference between civil versus criminal, civil, you can be fined, but you will not go to jail. Criminal comes with jail time. Okay? As far as I understand it, that's the big difference between civil versus criminal. So let's talk about assault. First of all, everyone's done their vocab. So what does assault mean? Yes, Nancy. To threaten. All right, so if I say, I am going to throw this pointer at you, is that assault?
Feel threatened.
Okay, that is assault.
Isn't like intent to do an injury or something?
Intent to injury. If I raise my fist at you, right? Is that assault?
Yes.
Yes. Okay. If I pull out a knife or a gun and I'm pointing at you, right? Is that assault? Yes. Okay. If I raise my fist and then I punch you, is that assault?
No.
That's exactly.
That's a bad
Good. Actual physical harm no longer falls under assault. So that is different than the kind of common meaning we normally think about when we say assault. It's like, oh no, they assaulted me. The first thing you think of is, oh, they got beaten up, right? But that is actually not the legal definition of assault. Legally, assault is just a threat, right? The threat of immediate bodily harm. It can be a verbal threat, it can be a physical threat. Right? Physical contact is not required for it to be considered assault. So, in medicine, so in radiography, what could be considered assault? To give you an example. All right, look, patient, if you don't hold still, I'm gonna have to put you in this really uncomfortable position instead. I'm gonna have to do something to you to make you hold still, right? That would be assault. You're threatening the patient with physical harm or discomfort. It's like, all right, if you don't hold still, I'm just gonna slap your wrist, okay? No, can't do that. That is assault. However, actually carrying out that threat, or actually physically harming the patient, I believe you all mentioned it earlier. What does that fall under?
Battery.
Battery, good. So touching or physical contact without consent is battery. And not only without consent, it needs both consent, right? It needs permission and a reasonable justification. Example, if you are positioning your KUB, patient's laying on the table, and you just reach over and start palpating for that iliac crest without saying anything to the patient. Is that battery?
Yes.
It is, right? Because you have not gotten permission from the patient yet. So that's why it's important to be talking to the patient, letting them know what is going on, right? That way they can object if there's anything that they do not want you to do. Okay, let's say that you ask the patient, okay, for this KUB, I need to make sure I am in the right place. So may I palpate your pubic symphysis? And they say yes. And then you palpate the pubic symphysis. Is that battery?
Yes.
No,
No, they gave you
they gave you
consent.
permission.
But they don't know what it
But-
is.
They finna find out.
Because I think it is
So-
like, it's not normal and unlawful.
I would say it's reasonable because you said the pubic symphysis, and given that pubic is a key term,
But
like
they might
What
not
if
know
they
what
Do
don't
you
it is.
have any reason to ever palpate the pubic symphysis?
No.
No, because there's other places that you can.
Correct.
Which is the
There's
trophy.
never a reason you need to palpate the pubic symphysis. You could palpate the greater trochanter to find the same level. You could palpate the iliac crest, which is what you should be doing. You could ask the patient to point out the belly button to get around the level of the iliac crest. There are many ways to position your KUB without ever needing to palpate the pubic symphysis. So no, you do not have reasonable justification for that.
Dang.
So
A
that
little too
could
excited there.
be
Why?
battery.
Because, I mean,
Uh,
she,
Well, you wanna take
she
care
or
of
he was asked, or she was asked, and they said yes, but, yeah, they don't know what it
It was
is,
just a-
but I mean, you still ask.
I mean, that's
No,
like
it was
very
a
private
trick
area,
question,
so you
though.
just can't, like,
If they come back later and they complain, right,
they can come back and
You
say,
are-
"Touch me."
you're on very shaky grounds here because you really do not have reasonable justification to be palpating here.
So in a tech in that situation would be posed with the question, well, why didn't you do the trochanter, or why didn't you check for the
Yeah, like, why did you touch your?
Yeah, essentially.
Right.
In the first place.
like you have to justify why you did it, and then even then it's never really
Correct.
okay.
So maybe there is an edge scenario where you could reasonably justify it, but in most cases,
Well, yeah,
probably not.
broke down. Thinking about the permission part.
So it is both permission and reasonable justification. Physical injury does not need to occur for the action to be considered battery. Right? Once again, even if you palpate for the iliac crest and it doesn't hurt the patient, or it doesn't injure the patient, just the fact that you are touching them without their permission is battery. Okay, you will get patients where you try and touch them and they will freak out. They're like, don't touch me. So it's important that you always check with your patients ahead of time.
So it wouldn't necessarily be assault if they expect you that you're gonna touch them or whatever, or because like it says they expect bodily harm for an assault, but if I just tap Shaheen and she like says, oh you or like if she sees me going to touch her, she can't like say that's assault. Like, hey.
So just reaching out to touch someone
Mm-hmm.
probably is not assault,
Okay.
It's not
but the act of touching them without their permission could be construed as battery.
Okay.
Right? Would it be? That's more up to the courts to decide, right? This is legal stuff, it's law. The courts are what end up deciding ultimately if a certain action is or is not assault, battery,
Right.
defamation, false imprisonment, whatever. Right? But the best thing is to try and avoid even getting close. Right? Avoid even getting close to this. So always talk to your patients, always check with them first before you attempt to palpate them.
Like you can have a person that's AMS and they believe anything and everything.
So once again, coming back to reasonable justification. If you perform an X-ray on the wrong patient, let's say that your order was for patient A, but you X-rayed patient B, is that battery?
Yes.
Yes, because they have
That is battery,
It's not
right?
even touching you, like.
So even if patient B gave you permission to do the X-ray, there was no justification to do the X-ray. There was no reason you should have done the X-ray on patient B. You were supposed to do the X-ray on patient A. So that could be battery.
So you can go to jail for that.
So once again, this is civil, so you are not going to go to jail, but it could be a fine or something else.
Or like lawsuit.
This is like different kind of battery though, right? Because there's like, I know you can go to jail for certain types of battery.
So there's probably also criminal assault and battery.
Okay, okay.
So this would be more, or that case would be more of a like medical error sort of thing, or like disciplinary action.
So it could also be, medical error, might fall under negligence depending on how they try and spin it. Right? A lot of these things can possibly fall under multiple categories when something happens. Right? Once again, it is the law. Lawyers would end up being the ones to kind of decide what falls under what specifically. Right? It's kind of a fuzzy scenario. Normally I'll try and give you more cut and dry examples.
Oof.
All right. False imprisonment. So when you hear false imprisonment, right? Well, okay. Prison, imprisonment. I locked someone up in my basement.
Pause.
Right? False imprisonment. But in medicine, right? It doesn't just include locking someone up in the basement. This is any time you restrain a patient, or any time a patient even believes they are being restrained against their will. So, for this to be false imprisonment, two things must be true. One, patient is aware of their confinement, and two, patient has no reasonable means of escape. Okay. So, what was it? The other day we were somehow talking about patients and stretchers, and we got into the topic of, all right, well, can the patient be strapped down to the stretcher? Right? If the patient is strapped down to the stretcher against their will, so they realize they have been strapped down to the stretcher, they cannot escape from the stretcher reasonably, right? It's not like they can hulk out and just bust open the restraints. That would be false imprisonment. So we cannot just strap people down or restrain them for no reason. If a patient needs to be restrained, the restraints must be ordered by a doctor. So if you do see patients that are restrained, it is because there is an actual order from a doctor in the chart asking for the patient to be restrained for a certain amount of time. Once that time is up, the doctor would need to renew the order in order to keep the patient restrained. Does that make sense? All right, so a lot of times this is going to be used for patients who have an altered mental state, right? AMS patients. Okay, so patient is combative, patient is drunk, and they are potentially a danger to themselves or staff or other patients. Then a doctor would order restraints. The patient would be tied down, right? Using either wrist restraints or ankle restraints. And that would not be false imprisonment because there is an order from the doctor.
So that falls onto the doctor. If something was to go wrong or whatever, it's not on you anymore.
Correct.
So,
Yes.
so did you say that there's a time limit when the doctor has to review the order? I didn't get that point.
Yes, doctors will need to renew the order. Restraints are based on a certain amount of time. Doctors order restraints for a certain amount of time. You can't just have indefinite restraints.
So that every order will come with a time limit.
Yeah. And the nurses are going to be the ones that take care of that. Okay, you are not going to be the one putting on the restraints, right? That would be nursing's job to handle the restraints. Now, on the other hand, if you have a patient in the X-ray department, right, kind of like when I was acting earlier, and I was like, all right, I'm done, I don't want to do the X-ray. And you have the technologist run over the door and lock it. And you run over to the other door and you lock it. And you trap me inside the room and you're like, you are not leaving until you get this X-ray. Is that false imprisonment?
Yes.
Yes, that is false imprisonment. Okay. So, false imprisonment is a crime, it is a tort. Right? So, make sure that you do not restrain a patient unless it has been ordered by a doctor. So, let's say that you need to hold a patient's arm in position for an X-ray. Are you allowed to tie it down in order to get the X-ray? No. If you tie the arm down, that is likely to be false imprisonment. What can you do? The most you could do is maybe weigh the arm down with some sheets, or maybe you could use sandbags, or maybe you could use a small amount of tape, right? But tying that arm down would be false imprisonment.
Not even with the consent of the patient, sir.
No. Yes,
What
Emily.
if they come in, like, already restrained to the stretcher by law enforcement?
Mhm.
Do we take that, or is it something that we take off?
Great question.
Or do we pay the doctor to be like, well, you can take it off and then take it
All right, so yes, you will be working with inmates. Inmates will be handcuffed to either the stretcher or the wheelchair. What do you do as a tech? Especially when you can't do the x-rays with the handcuffs on or the shackles on. You will ask whichever officer is supervising that patient, because these restraints, right, are now law enforcement. It is not the doctor, right? So you ask law enforcement, can we take these off to do the x-ray? Okay, we really need to take them off to do the x-ray. If we don't, it's gonna show up inside the x-ray, or I can't get the arm in position, or whatever reason. Either the officer will say, yes, sure, that's fine, which is about 80% of the cases. Or they'll say, no, I'm not allowed to make that decision. I would need to speak to my supervisor. In which case, all right, go ahead, call your supervisor. Let's see if they agree to let you take these restraints off. Right? But at the end of the day, it is going to be up to the officer accompanying the patient whether or not to take those restraints off for you. Right? You would not be the one doing that.
Would that
Yes.
sorry.
Go.
Would that officer then be able to say, or their supervisor or whatever, say like, no, we can't take this, so we can't take these off, we can't do the x-ray?
Yes, so they say we cannot take them off. At that point, it is going to be your decision whether or not to proceed. It's either going to be, we cannot do this x-ray, send the patient back, bring them back when it is okay to take off those shackles, or I'll get the best image I can with these shackles on, but if the doctor says that this is still not sufficient, we'll need to get the shackles off at a later time.
So you wouldn't just ask the radiologist like ahead of time saying like, hey, this is what the situation is, do you want me to proceed or no?
You should be able to make that decision as a technologist.
Okay.
Because you will know how much the patient is able to move. You know exactly what position the patient needs to be in. You would know that better than the radiologist. And that's something I want to make a note of. Radiologists have no idea what your patient condition is. All they see is your x-ray. They don't know if your patient was walking and talking fine, if they were having a panic attack, if they couldn't stand, if they couldn't sit, if they had blood sores on their side, if they were in handcuffs, if they were in restraints, if they were shaking. They have no idea what your patient was like. All they have is your image. Okay? So, who is going to be the best person to decide whether or not a patient can do something? It is going to be you, because you are the one that knows the patient's condition. You know what kind of position the patient needs to be in. You have the best concept of whether or not the patient can get into that position. And if not, you're the best one to know what other alternatives you have. Are we okay with false imprisonment?
No, but
No?
no, like I'm not okay with it,
Oh.
but we can move on.
All right, that's right. We should not be okay with false imprisonment. Right? We should not be okay with it. This should not ever happen. Okay, defamation. So defamation. This was pretty big in the news recently, right? With Johnny Depp and Amber Heard. Right? Regardless of your opinion, doesn't matter which side you were on, right? But it was but a lot of defamation from both sides, right? He said this, she said that. Right? So defamation is any time confidential information is shared, which leads to ridicule, scorn, loss of job, or any other injury. Right? So you say something, you review information that is confidential about someone, and then that information leads to some sort of harm to that person. Okay? Whether it's physical, emotional, financial. there are two types of defamation. There is slander and there is libel. And it's important that you know the difference between slander and libel. Okay, libel, if we take a look here, libel is physical defamation. It is written, or it's typed, or it's photographs, it's a magazine article, it's a blog on a website, okay, it's text messages sent to a friend. That is libel, right? It's some sort of physical, written, or tangible communication. Does that make sense? On the other hand, slander is verbal. It's spoken, right? So it would be me whispering to you, or me chatting in the elevator, or me giving an interview on TV, right? That would be slander. So
what Amber did was libel.
She did.
So
She did both.
Oh, she did both.
So, for example, with Amber Heard, right, she wrote an article or like an editorial in a newspaper, right? So, writing an editorial, right? Defamation would be libel. Right? On the other hand, if later then she gave an interview, and during the interview she was talking to the interviewer, and she said the same information, at that point it is slander. So libel, written or physical, and then slander is verbal. So, an example: if Charo and I were walking down the hallway of the hospital, right? And I was telling her, man, that patient A, he smells so bad. There are like maggots crawling out of his foot. Like, my goodness, that was terrible. I can't believe he can live like that. And I passed by someone, and they're like, oh, I know that person that you're talking about. All right, let me go spread the word, right? And then they go on Twitter and they're like, oh, I heard that patient A smells horrible and they have maggots crawling out of their feet. Right? And then person A gets fired because their employer is horrified of maggots and cannot tolerate smells. I don't know. So, when I was talking to Charo, what was that? That was slander. When the person went on Twitter and typed that out, what was that?
Libel.
Libel. So are we clear on the differences?
Yes.
Right. Privacy of records. So this is articulated in the American Health Association's Patient Care Partnership, which you can find right here. Right. But records should be kept in a secure area with access on a need-to-know basis. So, not everyone should have access to patient records. And even if you do have access, you should only access the parts that you need to view. And we talked about this last class as well when we were talking about HIPAA, right? So, if I'm looking at a patient's chart and I need to check their pregnancy status, the only thing I should be looking for are their labs for the pregnancy test. I should not be viewing any other information. If I need to check to see if the patient has had previous x-rays done before, I can go to the imaging tab and check their x-rays, but I should not be looking at anything else. It should just be on a need-to-know basis. So only when you're taking care of that patient and only the information necessary to take care of that patient.
So,
Yes?
what's the difference between privacy and confidentiality? I mean, and then it goes on to say two principles. One, they mean about the same thing, don't they, sir?
Privacy and confidentiality. Let's see. Do they have different definitions?
Let's say it's page 323.
Well, confidentiality would be like patient and tech, or like patient and doctor, where
Like-
they can't, it's only between them two, right?
Yeah, I would think confidentiality is like doctor or tech and then third party.
Yeah.
Whereas privacy is just the patient.
So where are you seeing?
So page 323, right at the bottom, sir. There's the first sentence with the heading privacy of records.
Yes.
Privacy of records and confidentiality are two principles.
Privacy of records and confidentiality.
I mean, basically the same thing.
So you can think of them as almost the same thing, right?
Pretty much.
So if you were to ask me, to me, what the difference is more like privacy of records is that it's talking about the records, right? So the physical item should be kept private. Confidentiality is more of a person thing, right? I should be able to keep quiet about the records, right? About what information is in the records, right? So if something is confidential, I should not be speaking about it. If something is private, people should not be accessing it, right? That's kind of my view on privacy versus confidentiality. Okay, I'm not going to make that a test question. What's the difference between them? Right? You can treat them as about the same thing, which is that information should not be shared. Now, patients do have a right to their own records. That does not mean they have unlimited access to their own records. The patient has the right to their own records, but the provider gets to choose how and when to release the information. So just because a patient asks to access part of the record does not mean the provider has to immediately grant access. Yes, Jay.
Does that apply to all information? Like, I would assume that some medical information that the patient or whoever needs to access needs to be able to access it 24/7, like list of medications and things like that, like actively.
So honestly, that is completely up to the provider.
Really? Wow.
So most providers would give access to something like that. But for example, if there was a psychiatry report in the chart, they may not give unlimited 24/7 access to the psychiatry report because there may be information in there that should not be shared with the patient immediately.
Oh, okay.
And of course, always keep HIPAA in mind. By the way, what does HIPAA stand for again? And also information.
Health
Insurance, portability, and accountability.
Very good. Health insurance. Not information, right? It's actually health insurance.
We were testing you, Mr.
We were
testing you.
Yeah, we were testing you.
Do you know?
Yeah, make sure you knew.
Well, I mean, you heard my question mark when I said information. I was like, really?
Yeah, we were testing you.
Really? Now, information. Is that what you remember?
Sounds like a test question now.
So it was an
He's
insurance
like, I'm
act
gonna
with a
add
whole
this
bunch
to
of other
that.
stuff.
That's gonna be one of the answer choices too.
So health
It
insurance.
will be. It absolutely will be. If I make that question.
Health information, and everything else is right.
So originally it was an insurance law, but there were other things that went along with the law, and part of that was
That's why it should be health insurance.
patient privacy.
It's health insurance, patient.
We should change it to
Health insurance, portability, and
It
accountability.
should.
It is what it is.
It is,
It is what it is. Okay. Next up, we have fraud. Fraud is any willful or intentional misinterpretation of facts or misrepresentation of facts that may cause harm to an individual.
Accountability.
Okay, so,
It's on the page.
for example, like this comment, the doctor will be with you in a few moments. He's trying to figure out what disease goes with your insurance. Right? So that would be fraud, right? Making a diagnosis or stating a disease which the patient does not have just to get some insurance money. Right? That would be fraud. So, 3 parts are required for fraud. 1, an untrue statement was made knowingly with intent to mislead. So, if you gave information that you thought was true, but later turns out was not, that is not fraud. Because you did not know at the time that information was false. Okay. On the other hand, if you do know the information is not true, but you still say it anyway, and you're doing it to fool the other person, that is fraud. Second, the injured party relied on the statement. So not only did you give that information, but they needed that information to do something. They were depending on the false information you gave them. And then, because they trusted your false information, damages happened. It might be monetary, it might be physical, it might be emotional, but damages happen because they relied on false information given by you knowingly. Yes?
So then it shouldn't be that may cause harm because it is causing harm, right?
So, the facts may cause harm, right? Because the facts may or may not have caused harm, right?
Right.
There is a chance that the facts did not cause harm. For those people whom the facts did not harm, that was not fraud.
Okay.
But for the ones that the facts did harm, that is fraud. Right? So, for example, let's say that you're my patient, right? And then I'm a doctor, Jay is my patient. I go to Jay and I'm like, all right, bad news. The results of your test results came back. You have XYZ virus. All right, XYZ virus. This is looking bad. But I do have a medication that can help you. It only costs $4,000 for 3 days. But it will cure you, don't worry. All right, so go to the pharmacy, right, and pick up this medication. So, I know that XYZ virus does not exist, I made it up. So, that was an untrue statement, correct? It was knowingly made, correct? I am intending to trick Jay by statement, correct? Okay, so I'm trying to make him believe that there is an XYZ virus that he is infected with. Okay, he's my patient. He's relying on my advice, correct? So he is relying on my statement. So now comes the damages part. If Jay then goes out and actually buys my $4,000 snake oil medication, he has incurred damages, hasn't he? On the other hand, if he thinks, you know, I think I'll take my chances. Let's see how bad this XYZ virus is. And he does not purchase the medication. He has not incurred any damages, right? He has not lost any money. So, fraud has not been committed to him because of that. Only when he lost money, right, when he incurred damages, did that become fraud. Right? So, I misinterpreted the facts. My misinterpretation of the facts may have caused harm. Right? It could have caused harm, or it could not have caused harm. Right? And depending on whether or not damages actually occurred, that will determine whether or not that was truly fraud. Does that make sense?
Yes. So, I'm sorry, go ahead.
Go ahead,
I have a question. Sir, can you explain the joke here because I'm not familiar with the insurance system. What is the joke? The doctor will be with you in a few minutes. He's trying to figure out what disease goes with your insurance. So the Was
So-
that the doctor will try and face
So
the
let me try to
insurance.
explain that. So the patient has insurance. Insurance will pay money for certain diseases. Other diseases, they'll say it's not covered. The patient has to try and pay themselves. Right? Usually it's easier for doctors to get money out of insurance than out of patients. So they like the insurance company to pay them. So the joke is that the doctor is going through his book trying to figure out what disease the insurance company will pay him for, and then he's going to say that's the disease the patient has. Right?
So the doctor has access to the insurance of the patient, and the patient is going to get that money.
Mhm,
That's
yes.
in records and stuff
I
like
see.
that. But the fraud is that he's making up.
Making the money,
disease.
money out of his insurance.
So, as far as X-ray goes, right, what could be fraud? For example, doctors ordering X-rays the patient does not need. That is fraud. Right, the doctor knows the patient doesn't need it, but they ordered the exam anyway, so that they can get charged for the exam.
But that's not on us. That's on the doctor. That
All right,
ordered
that's not
it.
on us, that is on the doctor. Let's see. Okay. What if So what if you shot an X-ray and then you realize that you put the marker on the wrong side? Okay. And so you're like, all right, I'm just going to erase this marker from the image so no one will know. Right? So now there's no marker on the image at all. And then the patient needs that image to do something. The doctor takes that image and does something with it. So does something to the patient, and the patient is injured because of the lack of a marker. Right? Maybe the doctor did the wrong side or something like that in the surgery. Right? So yes, doctor was negligent. They should have made sure that the image had a marker. They should have made sure of the correct side. But you as a tech, have you committed fraud? You have, right? Because you created an untrue statement with intent to mislead. You altered the X-ray image so that people would not see your mistake. And because of that, it caused injury to that party. So we want to avoid altering our images as much as possible. Like Mr. Donahue says, X-ray images are a legal document. Right? Your X-ray images can be used in the court of law. So you need to make sure that your images are solid, that you did not make any changes to them that would affect their legality. Are we okay with fraud? Are
No.
we okay with the concept? Do we understand the concept of fraud? Okay.
I had a question. It may not necessarily be fraud, but I'm trying to sort of figure out. This one's a little bit more personalized. When I was with Methodist for my heart, whoever assigned me the wrong medication, and then I went to Walgreens, got that medication, and then later that day, whoever covered their behind and erased the fact that I did not go pick up my medication and they didn't like administer that prescription, and I was in a legal battle for like 3-4 months.
Okay, so I'm going to repeat that. Let me know if I have this correct. So Jane went and got a prescription for a medication. Then went to the pharmacy and got the prescription filled out, took the medication home. Later on, the person who created the prescription realized they had prescribed Jay the wrong medication. And so, instead of informing Jay, what they did was they changed the records to hide the fact that the wrong medication had been ordered. Is that correct?
Yes.
Okay. And
Total
Dude,
fraud.
it was a thing.
so, by changing the records, did that create an untrue statement?
Yes.
Yes. Was this done with the intent to mislead?
Yes.
Yes, to hide their mistake. Did the injured party, Jay, did he rely on the statement?
Yes.
He relied on that prescription, correct? So then the question comes, did the wrong prescription cause damage?
So that's what the thing was.
Mhm.
My heart got better. Deadass. Like, I cannot make this up. My heart got better. Or, that's what they told me, and that's why I went to go seek a second opinion. But they're like, oh no, but we made a mistake, but like your heart looks good, best it's looked in months. Like, do you want to do whatever? And my mom was like, no, and I said yeah, because like that shouldn't have happened. If it was truly the wrong medication, I could have gotten hurt, right? So that like spewed a whole legal thing with the
Right.
Methodists. And shout out Methodists, they suck. So, yeah.
Alright, so yes,
I'm not
right,
working
see, so this is, right, the case hinged on this final point, damages incurred. Right?
The damage was not incurred, right, sir?
So,
What's up?
that's up to the lawyers to decide.
I know, that's been literally what.
Correct. So if it had caused damage to Jay.
Where am I gonna
that would be
go?
open
Like-
context.
That's true too.
So that happened in medical center?
That happened here. Like, not necessarily here in Harris, but like, yeah, medical center Harris or
We need to
Alright,
see.
Methods,
negligence.
yeah.
So earlier I mentioned negligence
Ass.
on the doctor's part, right? If they did not check the image for a marker. So what is negligence? It is doing something or not doing something that a reasonable person would not do or would do under similar circumstances. Right? So either you did something a normal person would not do, or you did not do something a normal person would do. So, for example, in our little comic here, we need to schedule you for another surgery. We accidentally cut off the wrong leg.
Have you seen something like this happen, sir?
Yes.
Oh
Or-
my
so,
God.
sorry, I have not personally seen it, but I have heard stories from nurses I've worked with that this has
Take out
happened.
the wrong kidney and all that, right?
Mhm. Yes.
I have an actual,
Charo, yes.
yeah. So,
What's that?
you know that my urethra was severed. It wasn't negligent because she looked. She tried to check to see if that had occurred because everything else was not supposed to happen. So kind of like I told you, they read it wrong. It was supposed to be smaller, it was bigger. So they went in they tried to go in through my navel, but because it was so big, they ended up having to go and cut me open to go in. So because of that, she, in her mind, she thought it was a possibility that they may have nicked it, trying to get it out. And so we had talked about it after surgery, and she said she had checked, and she brought in a neurologist, and they said it looked good. So they sent me home, but in actuality, it was cut. But they couldn't, I don't know, they couldn't see it. So, but they did try, so that wasn't negligent, Had they not checked, and had they not brought in a urologist to try to double check what she was already looking for, that would have been negligent.
Correct.
So where's the
But
medical
she-
error then?
Sir, she was
They
okay
severed my urethra.
by
Yeah.
asking a
Oh,
neurologist to see, but the neurologist was wrong, but he couldn't
It wasn't that he was
pinpoint it.
wrong, it was just that I had a lot of swelling, you know how what happens after surgery, right?
Right.
So it was a lot of swelling in there, so it wasn't that they weren't looking for it, it
We
was
couldn't
just.
see it.
So what they did do was they put a stent in to try to,
Open it back up.
yeah,
So that would be
because
a
she
medical error.
wasn't sure.
That's what my question was. So, like, where was the medical error outside of just the nicking action? Was it
The whole thing.
them not being able to see it? Was it like
It's not.
it sounds like
technically-
multiple.
This is what I'm saying, the error was in the cut, but it's not negligent because they checked, like reasonably doing something you would or would not do. The
Correct.
reasonable thing was they checked. And then she went even further to bring in, somebody who was on call at the time at the hospital to check further, cause that would be their area of expertise.
Right.
So they still, because I had a lot of swelling, they still didn't find it. So he came in the next morning and put the stent in because the swelling had kind of went down and he was able to see only a small cut. But it was, in actuality, it was severed. They said that if the scar, if I had it like scarred, like if it didn't, yeah, it would have been more pronounced. But because it was so, you could barely see it, he still put the stent in. So to me, that wasn't negligence.
Right.
That wasn't negligence.
Good, so let's talk about that, right? Because, remember, we are all human here, right? Healthcare providers are human.
Right.
Healthcare providers will make mistakes, right? But the question is, the mistake they made, is it a mistake that another person, under similar circumstances, could also make? Right? Is it a reasonable mistake? So, for example, you get an IV, they try and put the needle in, they miss the vein, right? Is it negligence that they missed the vein?
No.
No, right? It's reasonable to expect that someone else could have also missed the vein. But then, what if, on the other hand, after missing the vein, they went ahead and tried to inject the medication anyway? Would a reasonable person have done that under similar circumstances? No, right? So at that point, that becomes negligence. So there is an expectation that mistakes will happen. Would a reasonable person, under similar circumstances, make that same mistake? If the answer is yes, it is not negligence. If the answer is no, then there is an argument for negligence. Would a reasonable doctor, under similar circumstances, have cut off the wrong leg?
No.
No, most doctors would cut off the correct leg. So is this negligence?
Yes.
Quite possibly. Let's take a look at the other criteria. So, first of all, the provider has a duty to the patient, right? This is the doctor that is taking care of the patient. There is a certain standard of care. Secondly, there was a breach of duty by acting or failing to act. So they did not follow the standard of care. They moved away from what would normally be done. And from there was a compensable injury that came about because of this breach of duty, right? A causal relationship between this injury and this breach of duty. So, is the surgeon responsible for the patient? Is there a standard of care? Yes. Did the surgeon break their duty by failing to act, by failing to check that they were cutting off the right leg? Yes. Is this an injury, right, that is compensable and caused because he failed to check? Yes. So this is negligence. So, in X-ray, right, so would you as a radiology, as a rad tech, is there anything that you could do that could be classified as negligent? Or is this all going to be on the doctors?
X-raying
Yes.
the wrong part?
X-raying the wrong part. Order says right hand, you shot the right foot. Is that negligent?
Yes.
Yes, you have a duty to your patient. You did something that most people would not normally do under similar circumstances. You caused an injury, extra dose, right? And so you are liable for negligence. Another one, let's say you have a patient in a stretcher. And let's say you bring the rails of the stretcher down so that the patient can get off the bed and do the x-rays. And then afterward, the patient gets back on the stretcher and you do not put the rails back up. And then you try and drive your patient back to their room and they roll off the bed and fall to the ground. Is that negligent?
Yes, sir.
Yes, right? Most people in that situation would have put the rails up. and you did cause an injury to the patient. That is negligence. Okay? Any questions about negligence?
Sir?
Yes.
If one doctor diagnoses something and then you take a second opinion and the other doctor thinks that so diagnoses something else or the same thing, and the person who diagnosed first was totally wrong,
Mhm.
is that negligence? Would that come under negligence?
So, for that first doctor, the question becomes, did they do their due diligence in trying to diagnose? Did they just diagnose the first thing they thought of? Or did they look at the test, did they order exams to show that they have a reason for their diagnosis? Right? If the doctor's just like, oh yeah, sounds like coronavirus, that could be negligence because they're not trying, right? On the other hand, if they ordered exams and they showed that this is why I think it is coronavirus, even if it's not, that's not negligence because they did their duty. However, if you take this too far, you end up with our current hospital system, where our patient says, okay, I think I might have this, and then the doctor orders 20 different exams just to make sure they don't miss anything, so that they cannot be accused of negligence. Does that make sense? So, when you go to the hospital and you see a whole bunch of exams being ordered, you're like, this feels kind of unnecessary. A lot of times it's because the doctors are trying to CYA, they are trying to avoid being accused of negligence by showing they are trying to do as much as possible for the patient, even if it may not be necessary. Right? So there is kind of a range here, right? You don't want to go too extreme in one direction or the other.
So in the case that the patient did not go to the other doctor and went ahead with this doctor's decision, and that
Like I said, it all depends on how the first doctor came to their decision. Right? It does not matter what the decision ended up being. Whether it's right or wrong does not matter. Did the doctor do due diligence? Did they do something that a reasonable doctor would have also done?
Can negligence be paired with other like torts and stuff like that?
Yes, it can be paired with other torts.
So someone could have fraud and negligence, or like defamation and negligence. Okay.
For example, doctor could be negligent and then could try and commit fraud by trying to cover it up.
Yeah. Or false imprisonment and negligence.
Yep. So yes, multiple torts can overlap depending on the situation. Right, so speaking of which, right, we were talking about standard of care, right? So, standard of care, there is an expectation of skill, knowledge, and care possessed by a member in good standing with their profession. For example, when you go to a doctor, you expect them to know a certain amount of information, right? When a patient comes to you for an x-ray, they expect you to be able to have a certain amount of information, have a certain skill level. That is the standard of care. ASRT has settled practice standards to kind of give a baseline as to this is the minimum that a person in the profession should be able to do. Right? Individuals will be compared to these standards to determine if they are compliant with professional practice. So if you meet the requirements, then you're compliant. If you do not meet the requirements, you are non-compliant. So you should have a certain minimum skill level and other requirements, right, to meet that standard of care that is expected of you. All right, few other legal theories we have to talk about. Right, over here we've got some Latin, res ipsa loquitur. Loquitur, loc meaning like speech, like if you've ever heard the term loquacious, someone that likes to talk a lot. Right, in this case, res ipsa loquitur, the thing speaks for itself. Something is so obvious, right? Something is so obvious that it needs no explanation. A patient is injured through no fault of their own while in complete control of another. For example, if a patient goes in for surgery and the doctor cuts off the wrong leg, right? Is it the patient's fault that the doctor cut off the wrong leg? No. Was the patient able to influence the outcome during surgery? No, they were asleep, right? They were in complete control of the surgeon. It's the surgeon's fault that the leg was cut off. The wrong leg was cut off. Right? Res ipsa loquitur. The thing speaks for itself. Right? It's an injury that is so obviously not the patient's fault. Like, there's no way you could blame the patient for this. Secondly, respondeat superior. Okay? Superior, master, right? The master speaks for the servant. So, this legal theory states that not only is the lower level employee responsible, their managers, right, the people over them, supervising them, they are also responsible. So if you make a mistake as a technologist, not only would you be responsible for that mistake, but the doctors over you would be responsible, and the hospital that you work for would be responsible, right? So if you shot an X-ray, or if you did something, okay, you did a CT scan, and you over-irradiated a baby, and you gave the baby cancer, okay, which would be very, very bad. Please do not do that. But you gave the baby cancer with a CT scan, and the parents come back and they want to sue. Not only are they allowed to sue you, but they are allowed to sue the hospital as well. Why? Because the hospital also speaks for you. The master also speaks for the servant. Right? Does that make sense? Right? So a mistake of a single individual is not necessarily confined to that individual. Everyone up the chain shares responsibility. And it's like, did we not have protocols in place to keep this from happening? Did we not have appropriate supervision, right? Could something else have been done to avoid this incident? So everyone up the chain of command, including the hospital itself, would be held responsible. Okay. This also goes into corporate liability. The healthcare facility is responsible for employees and contractors, including physicians. Right? Duty of reasonable care in selecting and retaining employees and staff. So the hospital should make sure that they are selecting and retaining the correct employees and the correct staff. They should not be selecting people that are not qualified for their positions. Okay? Same thing for equipment. They should be properly maintaining equipment in the facility. Okay? Same thing for availability. Equipment and services should be available. So the healthcare facility is responsible for all of this. Anything goes wrong, that facility can be held responsible. Okay, great. Final slide. And then coming back full circle, right? Coming back to consent. Okay, we talked about informed consent earlier, right? But you do not need to give informed consent for every single thing. In medical imaging, the most common form of consent is implied consent. So implied consent does not require the patient to sign anything, right? So when you do a chest x-ray, the patient does not need to sign, I allow the technologist to do this chest x-ray on me, right? By showing up and verbally agreeing to go through the procedure, they are implying consent. Right? Now, they can still refuse the procedure, right? They can still withhold their consent. But if you say, all right, we're going to be doing an x-ray today, and the patient's like, all right, yeah, sure. That is implied consent. However, if we are doing any type of invasive procedure, anything where we need to break the skin or go inside the patient, that requires informed consent. So this is the thing that actually requires a signature. And not only do we need a signature, we need to explain the entire procedure to the patient. So, what is the procedure? Why are we doing it? What are the benefits? What are the risks? Is there anything else we could do instead of this procedure? Right? And not only do we need to explain it we need to explain it in simple terms. There's no point in explaining the procedure if the patient does not understand what you are trying to say. For example, if I told you that, all right, we need to do so we need to do an arthrogram of your shoulder. The reason is because we believe there is tendinitis, and we're going to go into the bursa with a 24 gauge needle, inject some omnipaque, and then use fluoroscopy to image the joint space. Alternatives would be going to sonography and having them use to view it instead. Would a normal patient understand what's going on? No, they might have heard needle and that's about it, right? So it's important that for them to give consent, they need to know what's going on. You need to use plain, simple language to give informed consent. Right? So, what are the parts of informed consent? Authorization, right? Patient says you are allowed to do it. Disclosure, where we give benefits, risks, alternatives. Anesthesia clause if necessary. We will be using anesthesia in this procedure. A no guarantee clause for therapeutic procedures. I can't guarantee this procedure will work, that you will get all the benefits we've listed, right? There are no guarantees in medicine. Tissue disposal clause, okay? What happens when we take tissue out, like for a biopsy? A patient understanding clause, I understand all the information that was provided to me. And then a signature clause, where they sign, and a witness needs to sign as well. This is someone who is not participating in the procedure. Right, so in this case, right, a doctor would sign, and then you, as the technologist, if you're the one doing the fluoro, you should not be the one signing the witness, right, because you're also participating. There should be someone else who is not actively in that case that should be signing that they witnessed the informed consent. Are we okay with this? Any questions about implied versus informed? All right. Anything from you, Mr. Donahue?
Oh no, I just had to walk away from my desk for a second.
All right. Well, in that case, it is 2 o'clock, so we will end the class here for today. This was the end of chapter 26.